Imagine ending a long, exhausting week by drawing a warm bath, pouring a glass of wine, and finally letting your guard down because your blood pressure numbers have been steady for months. Your doctor is thrilled, and that tiny daily tablet of amlodipine is doing its job seamlessly. Until you stand up, the room violently tilts, your heart races out of control, and you realize you cannot walk without collapsing. You did not miss a dose, you did not do anything reckless, yet an ordinary harmless habit quietly collided with your prescription in a way that turned dangerous. Amlodipine is one of the most widely prescribed cardiovascular drugs in the world, trusted by millions to keep hypertension in check. But the real dangers patients face almost never stem from the pill itself. They come from everyday triggers, hiding in plain sight that nobody ever warned you about. In this video, we are breaking down the critical daily interactions you must know about, including a deceptive over-the-counter item millions reach for that silently sabotages your cardiovascular system. To understand why these daily habits can backfire, look at how amlodipine operates inside your body. As a calcium channel blocker, it prevents calcium from entering the smooth muscle cells lining your arterial walls, keeping those blood vessels relaxed and wide, so blood flows with minimal resistance, effectively lowering your blood pressure. However, when you combine this mechanism with routine alcohol consumption, even just an evening glass of wine or a single afternoon beer, you are introducing another powerful vasodilator through a completely different biological pathway, compounding the relaxation effect, causing blood pressure to drop precipitously and significantly elevating the risk of sudden fainting, dizziness, or catastrophic falls. Because amlodipine carries a remarkably long half-life of 30 to 50 hours, the drug remains continuously active in your bloodstream for days, meaning there is no safe window where a drink will not interact with the medication. And over time, regular alcohol intake triggers sympathetic nervous system activation that produces volatile, erratic blood pressure swings that leave your doctor guessing. The second silent disruptor is hidden dietary sodium, which attacks your cardiovascular system from the exact opposite angle. While amlodipine works tirelessly to widen vascular pipes and reduce arterial resistance, blood pressure is equally dictated by the total volume of fluid circulating through those pipes. When you consume excess sodium, osmotic pressure draws massive amounts of water into your bloodstream, forcing your heart to push a heavy fluid load against widened vessels and directly undermining the effectiveness of your prescription. Furthermore, because amlodipine naturally allows fluid to pool into the soft tissues of the lower extremities, high sodium intake dramatically worsens severe ankle and foot swelling, with the worst culprits rarely being table salt, but rather innocent-looking processed staples like canned soups, deli meats, packaged breads, and restaurant meals that pack thousands of milligrams into a single serving. The third trap catches many health-conscious individuals completely off guard: natural herbal remedies and supplements. The universal assumption that natural means completely harmless collapses when you examine how the liver metabolizes medication via the critical CYP3A4 enzyme system. St. John's wort, a popular over-the-counter herbal mood booster, acts as a potent enzyme inducer, forcing your liver to metabolize and flush out amlodipine at an accelerated rate, leaving drug levels in your blood too depleted to manage arterial pressure. On the flip side, licorice root and deglycyrrhizinated herbal preparations contain compounds that block the kidney enzymes responsible for regulating cortisol, driving excessive sodium retention, potassium depletion, and severe unexplained hypertensive spikes that masquerade as sudden medication failure. The fourth everyday hazard involves high heat environments like hot tubs, saunas, long steamy showers, or even strenuous physical exertion on humid summer afternoons. Whenever your body temperature climbs, your autonomic nervous system reflexively dilates superficial blood vessels to radiate heat away from your vital core. But because amlodipine is already artificially keeping your arteries fully relaxed, this dual vasodilation overpowers the body's compensatory mechanisms, causing blood to pool heavily in your lower limbs. The true danger strikes the exact moment you transition from sitting in heat to standing up. Gravity immediately pulls blood away from your brain, triggering severe orthostatic hypotension, tunnel vision, loss of balance, and traumatic falls, which is why older adults on calcium channel blockers must strictly moderate water temperatures, limit heat exposure to brief intervals, stay thoroughly hydrated, and always sit upright for several moments before standing. The fifth critical issue lies in erratic dosing habits, skipping doses, and doubling up. Because amlodipine's long half-life prevents immediate emergencies after a single missed tablet, patients frequently develop a false sense of security, taking pills unpredictably or swallowing 2 tablets at once to catch up after forgetting a dose. Doubling up instantly spikes plasma drug concentration beyond the safe therapeutic window, triggering profound hypotension, chest pounding, and severe weakness. Even more critically, clinical trials published in leading medical journals confirm that day-to-day blood pressure variability, the constant erratic fluctuating of your readings, is an independent predictor of stroke and cardiovascular events, regardless of your overall average, making a rock-solid daily anchor habit like taking your tablet alongside morning tea essential for long-term survival. Consider the real-world case of an active 72-year-old who tracked every single reading meticulously, yet watched her numbers climb over 4 consecutive months despite increasing medication doses. An in-depth audit of her daily life revealed 3 seemingly harmless changes. She had started taking a natural herbal sleep blend containing licorice root, spent 2 evenings a week relaxing in a wellness sauna to ease joint stiffness, and let her dosing schedule drift to random times throughout the day after retiring. Not one of these factors seemed dangerous on paper, yet combined, they completely dismantled her cardiovascular stability. Once all 3 environmental triggers were eliminated, her blood pressure returned to perfect control without requiring any additional medication. This brings us to the hidden 6th factor that causes the most immediate damage. Everyday over-the-counter decongestants, specifically cold, sinus, and allergy formulations, containing pseudoephedrine or phenylephrine. While amlodipine is designed to open and relax your vascular network, oral decongestants function by aggressively constricting blood vessels. And because their action is systemic rather than confined to the nasal passages, they work in direct pharmacological warfare against your medication, generating sharp, severe blood pressure spikes within hours of consumption. Always keep an updated list of your cardiovascular medications in your wallet, consult your healthcare provider or pharmacist before introducing any new supplement or cold remedy, and share this knowledge to ensure your daily routine supports your heart rather than secretly fighting against it.